Sarah's cryptic pregnancy journey. Sarah was a vibrant 32-year-old woman living a busy life, balancing her job as an events planner and her love for outdoor adventures. For months, she had been experiencing occasional fatigue and mild weight gain, but she attributed these changes to her hectic lifestyle and irregular eating habits. Little did she know that her body was harboring a life-changing secret. Sarah had always had irregular periods, so when her cycle became even more unpredictable over the past year, she didn't think much of it. She occasionally felt bloated and noticed her abdomen slightly rounding, but she dismissed it as weight fluctuation. She continued her daily routines, running around at events and managing her social life. Maybe I just need to hit the gym harder, she often thought. One crisp December morning, Sarah woke up with an unusual, sharp pain in her lower abdomen. It was unlike anything she had ever felt. Persistent, intense, and growing stronger by the hour. Concerned, she decided to visit the emergency department of a known hospital, thinking it could be appendicitis or a serious gastrointestinal issue. At the hospital, Sarah described her symptoms to the attending nurse. After some initial examinations, the doctor ordered an ultrasound to rule out any abnormalities. Let's take a quick look to see what's causing this pain, the doctor said. What happened next left Sarah speechless. As the sonographer moved the probe across Sarah's abdomen, the room fell silent. The sonographer exchanged a knowing glance with the doctor before turning to Sarah. Sarah, you are pregnant, about 38 weeks. You are probably in labor. Sarah's jaw dropped. What? That's impossible. I didn't even know, she exclaimed, her mind racing with disbelief and multiple questions. The doctor explained that Sarah had experienced a cryptic pregnancy, a rare phenomenon where the expectant mother is unaware of her pregnancy until late in the term or even until delivery. This can happen due to minimal pregnancy symptoms, irregular periods, or certain physical factors. Barely an hour later, Sarah found herself in the delivery room, surrounded by a team of doctors and nurses. The labor was swift but intense. With each contraction, Sarah's shock gradually turned into acceptance and then anticipation. Finally, at 3:42 p.m., Sarah delivered a healthy baby boy, weighing 7 pounds. As she held him in her arms for the first time, tears streamed down her face. She marveled at the tiny human she hadn't known was growing inside her. I can't believe this is real, she whispered, overwhelmed by love and gratitude. Sarah named her son Ethan, meaning strong and enduring, a reflection of the incredible journey they had unknowingly shared. Though unprepared, she embraced her new role as a mother with determination and joy. Family and friends rallied around her, helping her navigate the unexpected transition. Looking back, Sarah often reflected on how life had a way of surprising her. Sometimes the best things come when you least expect them, she said, cradling Ethan, her little miracle. Causes of cryptic pregnancy. 1. Intermittent spotting. Bleeding and spotting that can occur during pregnancy can easily be mistaken for a light period. Inaccurate pregnancy test results. Pregnancy tests are usually accurate, but errors do happen. It is possible for a pregnancy test to be negative even when a person is actually pregnant. Early menopause. Pregnancy symptoms can be similar to early menopause symptoms. If you're between the ages of 45 and 55, you may attribute symptoms to menopause instead of pregnancy. Fertility issue. If you've struggled with getting pregnant in the past, you may find it difficult to believe that you could be pregnant when you are actually pregnant. Lack of pregnancy symptoms. Common pregnancy symptoms like pelvic cramping, nausea, fatigue, or missed periods will not occur in such person. Not recognizing symptoms. A person may think their morning sickness is an upset stomach, or not getting their period may be an irregular menstrual cycle. No prominent baby bump. Pregnant belly might not be obvious on someone who carries more weight in the abdomen. Some people do not gain much weight or start to show until later in pregnancy. Irregular menstrual cycle. Irregular periods can make it hard to know whether you've missed a period. This is especially true if your menstrual cycle is longer than the average 28 days. For someone who may not experience as many periods per year, especially those with polycystic ovary syndrome, the absence of a period may not be an immediate red flag for pregnancy. Mental health and developmental conditions. Some research suggests that people with certain intellectual disability or mental health conditions, including personality and depressive disorders, are more at risk of experiencing a hidden pregnancy. Use of birth control. It is possible that these control measures may fail, even when applied accurately, leading to pregnancy. Finally, breastfeeding mothers. You can ovulate before your period returns while breastfeeding after childbirth, so it is possible to be pregnant unknowingly to you. So I also want to add that cryptic pregnancy is not the same thing as a hidden pregnancy as described by most of these traditionalists. I know some of them go as far as telling you that the pregnancy is hidden in your thigh and in some strategic locations of your body, and even go as far as asking you not to run a test or go for a scan because it will not be seen. Please disregard such information, and that is not cryptic pregnancy. For cryptic pregnancy, you are pregnant, but you don't really know that you're pregnant because most of these symptoms are masked. And if you go for a scan, definitely it will be seen.